Well, good afternoon, everybody. How nice it is to finally be
Hello.
able to see you. I got to sit outside and watch the conversation this morning, and all I could think of was, ooh, I want to be in there. That looks like it's going very well. It was fun, and I hope we can continue the conversation here this afternoon. You know, I want to stay with this idea of research here in the beginning part of our conversation. And you are all researchers. You've all been in the middle of this for a long time. How do we balance the need to get information out? For instance, the importance of the environmental impact research that Dr. Dominici spoke of. This idea of openness of data that we talked about this morning. And those two things balanced with the idea of we have to be patient, we have to take our time, we've got to do the research correctly and thoroughly so we know we've got it right. How do we balance those two things out and still, get people the information they need, especially in a society now that wants their information right now?
Okay, well, I'll get started,
okay.
I guess.
Dr. Dominici.
Well, you can't.
Can't hear you.
I can't hear.
Or you cannot hear me?
I can hear you.
You cannot hear me?
I can hear you.
Okay.
Perhaps it's just
People
we
in
who
the
can't
panel.
hear.
Yeah, we can hear you. I can hear you well.
We can't hear you.
Can they hear someone else of you?
Okay, we have an issue.
Do you guys hear any of us or no? I guess not.
My guess is
I
no.
can't hear anything.
Oh, they can't hear anything. Oh dear. Oh boy.
Francesca, you can keep talking. We can hear you.
Oh, okay.
Oh, I
But
can.
he can't.
I can.
Okay.
All right. So let me start. Let me.
If I can keep the paper, other side.
Can you see? I see. Carl, can you hear me? No. Okay. I should keep talking. Okay.
Okay.
So he was asking about the balance. So let me say, let me try to not lose my thought for a moment. I think it's extremely hard to balance a situation where the public needs to have information as soon as possible with doing rigorous research. I actually think it's impossible because rigorous research takes a lot of time, especially in presence of the COVID-19 data where the data keep coming. So having said so, I do think that the next
You guys know that, right?
plan B, so the plan A is impossible. Plan B is to communicate what we know with humility and responsibility. So I'm saying with humility by saying, this is what I guess is happening right now, and responsibility in terms of not saying anything if what you are saying is causing harm. So to me, the plan A is impossible, and the plan B is what you could possibly do. That's my answer for right now. I see other people have good.
Yeah. Well, this is Mike Osterholm. Let me offer a kind of an alternative approach on this issue. My career has obviously been in public health for 46 years, but 25 of those years were spent at the Minnesota Department of Health as a state epidemiologist. And we dealt with many outbreaks, really acute situations that required immediate action. And oftentimes the data we had were incomplete, similar to what John Snow had when he pulled the pump handle off of the well in Soho. And it was not that we were wrong ever. In fact, we knew that if we were ever wrong, publicly coming forward, identifying a product and recommending it come off the market, that would be the last time we'd ever be able to do that. But also projected that there would be much more information coming. And I think that type of a sense of kind of the in-between, the emergency response and sufficient data to take action are not at all inconsistent. On the other hand, we've seen over the past 2 weeks, I think, some real confusion about vaccines, where we had two advisory bodies to the FDA and to the CDC that are used to getting really detailed data, years in the making, that are answering questions that if we had waited on vaccines to answer those questions, we'd be 4 years in to the vaccine evaluation before we'd ever respond. And in the meantime, millions and millions of people would die. Well, that kind of led to a sense of frustration with those groups because they had many very legitimate questions that we're just going to have to continue to answer. So I come at this from the world of corrected science. Corrected science is a term we have to understand and embrace today. It's this issue of we learn, we apply, we study, we evaluate, we learn, we apply, we study, we evaluate. And in the process of doing that, we basically provide the public, though, with a roadmap of what we're doing, how we're doing it, when we're doing it, and when we'll know. And what we've done, unfortunately, I think, has given many people the sense that we should have had all the answers on vaccines yesterday. For example, we did have answers on safety very early on in that important bucket. We could tell you with millions and millions of people vaccinated what the safety profiles were. Can I tell you today exactly how we should be using these vaccines by dose spacing, what will happen with waning immunity? No, I can't. But I can give you the most current updated information, what we're learning, how we're applying it. Why do booster doses matter? What's it all about? What will it be like a year from now? And so I think that there's an approach we take where part of it is we do provide early information, but it's responsible information. And you mentioned the issue around the mask. And I just have to comment on that briefly because what happened there was not a disconnect with data. It was the fact that both the CDC and the WHO were years and years out of step with current practice. And the idea of an aerosol was something that aerobiologists and more than 150 of us involved in those kinds of research efforts put forward and said, you have to understand what an aerosol means. What kind of respiratory protection is needed for an aerosol? This is just a droplet issue. You can do it. And we did. We put forward all this hygiene theater, all this plexiglass, which was meaningless. What it was really all about was aerosols. So I just want to come back and say, even there, it wasn't about an absence of data. It was understanding what data we had and what it told us.
Excellent. Thank you very much. Does anyone else have a comment on this one? We do have a question from.
Cynthia.
Oh, I'm sorry.
Cynthia.
Yes.
Cynthia.
Yeah, I just wanted to point out that there's always a cost-benefit analysis that one needs to do, even in the presence of uncertain data. So, for instance, like one of the biggest ones is like, should we vaccinate children, and when should we do that? Right? We've been waiting a long time to vaccinate children, and even there's a debate where the American Association of Pediatrics was saying like, hey, we really need to assess this cost balance. We need to assess this decision very carefully in terms of its costs and benefits to our children, and so that's something that data analysts are really good at by now, right? We know how to do that now. So, I think these things should be taken into account very carefully.
Thank you. Thank you. We do have a question from one of our listeners. And it says, as I am someone who leads COVID interventions at a health plan, what's the most critical thing we can, the medical scientific community, do to turn the public trust around? Dr. Chun, do you have any thoughts about that?
That's a huge one because questions of trust aren't necessarily linked to questions of valid information, as we found out. And taking on people and accusing them of believing in conspiracies and being unintelligent isn't that persuasive either. So I think that one thing that's really important if we're talking about trust, and many people have said this, is to listen and to hear things through. And what I was hearing Francesca and Michael talk about, which is so important, is that science itself is often uncertain, but there's a working through things, a humility and a responsibility. And if that could be relayed to people who are mistrustful. That's absolutely key, because part of the reason why they're mistrustful is because they have this view of science as, claiming always to be right. So therefore, if they figured out this little thing, right, global climate change says it's going to be hot, but there's, look, it's snowing on a day that it should be hot, right? Then we've proven science is wrong, right? Sometimes when there is this desire to show somehow science is overwhelmingly right, when it is uncertain, when it is responsible, when it is humble, you could actually be backing yourself into a corner. And then people are saying, well, you claim it's this, but it's not. And I think what's absolutely key is to take this questioning on behalf of citizens, which is a good questioning. In democracy, we want people who question, to talk to them and to explain things. But because what's most dangerous isn't when people question, it's when questioning certain sources leads them to trust even more dubious ones. And that's the example of Invectorant that was brought up, right? Distrust of COVID somehow leads to trust of Invectorant. And that's the dangerous move. So I think that having this healthy questioning, understanding that science is part of this healthy questioning, is absolutely central to addressing these concerns.
Yes, Dr. Ossorio.
I'll just add.
Go ahead.
Oh, I was just going to add that I think two things. We also need diverse teams. We need visually leadership that is Democratic and Republican and independent, unified front. If it's in the community, you need, maybe pastors from different churches and, different civic groups and civic organizations. It's important that I think people feel connected to someone who represents them, who is then speaking about the data. And then to the previous point, listening to people's concerns, it's easy to say, it doesn't make sense that you don't get vaccinated. It's just crazy, do it for the public good. And yet we don't really hear some of the concerns that people are having and address them. Many older people in my community who remember the Tuskegee experiment are legitimately afraid, just like, completely lost trust in any type of government intervention for years and years and years. And some of their concerns were, well, if they're going to give me a free vaccine, why don't they also cover my insulin? Why don't they also help me in other ways that I want to be healthy? Why is it that if my medication runs out and I can't pay for it, the government doesn't help me stay well with diabetes? It doesn't help me stay well with my heart condition, but yet they're going to do whatever it takes to give me a free vaccine. And so it opens the door to other issues of justice. We're so concerned about COVID, and yet we let people die every day from other diseases that we could also help with.
Yeah,
Thank you.
I would absolutely agree with that, and just sort of leads into the comment that I was thinking about, which is one of the problems is that you can't start this in the middle of the pandemic, right? You can't start listening to communities all of a sudden in the middle of the pandemic. You can't start revising the way people think about science in the middle of a pandemic. So some of this, I think it really links to many larger problems, including the way we educate people in science, at least in the United States, right? That people think science is about facts and that the authority of science is about facts as opposed to having methods, right? And having to apply those methods in iterative ways, and how, you get slowly but surely you sort of triangulate in on new knowledge, and then you have to continually revise and update that knowledge, right? And if people come to this debate already with these kinds of if they come with certain ideas about what science is, it's really hard to change it in the middle of, a public health emergency.
Rhema.
Can I just,
Rhema, and then Mike, we'll come back to you.
thank you.
Yeah, so I've sort of been watching the pandemic on the sideline. It's not my real research program, but I want to plot on a vertical axis the number of scientific experts in the area of modeling and pandemic and public health, and on the horizontal axis how well countries dealt with COVID. And I think it might be inverse. It's probably unrelated. And I think that's the picture we need to put on our computers and hold it for the next 3 decades, because what we were doing, whatever we thought we were doing, wasn't making a difference to how our countries responded when push came to shove. And I feel the same way about the way we dealt with global financial crisis. I mean, there are so many examples of crises where we as a scientific community have not, for whatever reason, been able to do much.
Mike.
Yeah, let me add a perspective here that comes from wearing both a science and a policy political hat. I've served as an advisor in the last 6 presidential administrations, having served on the Biden-Harris transition team, as I was introduced earlier. On COVID, I served as a science envoy for the State Department in the Trump administration. I've advised the last 7, including this governor, the 7 governors in Minnesota on public health issues. No one can tell you my partisan politics. I'm just a private in the public health army, and that's my job, is to do my job. And I have to tell you, with all honesty and candor, this country has never been like this before. We are a country that is ripping apart. We are a country that is not simply a matter of listening. We're a country today in crisis. When you see your healthcare workers basically being taken to court to give the kinds of treatments that have never been proven to work, and when you see them threatened by family members to do things that are absolutely malpractice, but that's what they want, when you see the kinds of school board meetings where today people are afraid to be on a school board, they're afraid to be a school superintendent, they're afraid to be a teacher. I've been in this business for many, many, many years, and I've worked on some pretty tough crises. We were the first state and the first government body in the world to make HIV reportable. At the time, it was very controversial. I've never experienced in my previous 44 years what I've experienced in the last 18 months, the number of death threats, the number of vile and horrible, horrible communications. It's a different world. I don't want to sound like I'm saying we're not going to get through it. We have to for our kids and grandkids. We can't be Pollyannish. Don't tell me about listening more, because you know what? We've listened a lot. We've tried to understand. We've gone from a world of vaccine affirmative and vaccine hesitant people, of which there were very real, legitimate reasons why some people were hesitant to get vaccines. But we've now created a third category, vaccine hostile. They will go out of their way to find ways for others not to be able to get vaccinated. They will continue with the mis and disinformation, and they know it's disinformation. So I think until the body politic changes, we have a challenge as scientists. And it's not going to be just solved by us. It's all about society. It's everything that's here. And so I have to say, my experience of all my career, which you would think would give me more opportunity to be able to respond with what to do, I'm at a loss. I don't know. And I know many of my colleagues who also deal with policy issues like I do are also at a loss. So this is a very critical moment in our country's history as well as our science history.
Francesca, you had your hand up?
Yeah, I mean, I completely agree. And I think the question then back to the panel is the degree to which social media have been a contributor to the spread of misinformation and to the polarization. And I'm wondering, when, Michael, you are speaking about your tremendous amount of experience for 40 years career. I'm wondering, maybe you can share with us your viewpoint, because to me, what is dramatically different with this particular crisis and the COVID-19 pandemic is the access and the spread of misinformation that we're seeing through Facebook, to Twitter. And, if I can add for a moment, I actually found even Twitter, and among even Twitter from academics, being largely misused, where people becomes stars, like star in TV and, and Twitter about the worldwide expert on topics, where within the community, we know that's not the case, but still they get like a sense of, credibility they shouldn't have. So anyway, I think, it's really a question back to everyone is the degree to which social media has been contributing in exacerbating polarization and hostility.
Any thoughts on that, panel?
A ton.
Feel
I
free.
think that so part of the work we do is look at mis and disinformation and the spread of it. The fact that we have vaccine resistant people shouldn't be a surprise. There's been a lot of work that's gone into the spread of conspiracy theories and how they've been actually linked to each other. So the rapid spread of COVID conspiracy theories was linked to the existence of conspiracy theories already online. So there's been work that's been looking at that spread and how it was taking advantage of things that were already in place. So again, the question of what is already in place and what gets taken advantage of in a time of crisis. There's also been a lot of work done around not just listening to people, but the fact that what's happening, because a lot of people point to 2016 as the year of post-truth. It was the fake news election, et cetera. But what's important and interesting is 2016 was also dubbed the authenticity election, and that there was a way in which certain people and characters appeared authentic because they spoke to a truth of character or a different type of truth than factuality. And so what we need to keep in mind is that there's this battle over what is quote unquote authentic, and that people who are being quote unquote misled are being misled because they believe in a different form of authenticity, or there are different debates over authenticity or what is authentic. And I think what's absolutely key is that we understand the disconnect between factuality and authenticity, not so we accept it, but so that we grapple with it. And then we try to understand the relationship between them. And also, there's a ton of work that's been done on social media and misinformation, but I think this is more directly related to COVID-19, so I will leave it to people who want to talk more about their experiences with that.
Others who'd like to talk about their social media ideas? No? Well, I can tell you.
Can I just?
Okay, go ahead.
Sorry, I just thought since I'm speaking to you from New Zealand, I'd share with you some of the way in which I guess we've worked out these issues. And I think at least we're a very small scientific community because we're a country of 4 million people. And I think amongst ourselves, we try to be very restrained in speaking right through the whole pandemic. I have been on multiple calls and things, but we never, the statements that are agreed to, it's not a conspiracy, it's just a very strong sense of self-control. So I was reflecting when your panel was saying actually the public what we are here to do is to do the debate, to do the, uncertainty. And I think in our community, we felt, no, that's not what. Actually, we're unusual people. We like debate. We like that. We're not the norm. And so the norm doesn't want to hear us all spouting forth on our contradictory ideas. But that was my feeling over the last 18 months has been a lot of self-restraint by the whole kind of scientific community.
Cynthia.
Sure. So one thing I've realized throughout the last several years is that our educational system has completely failed people, because people are not thinking scientifically. They're missing even the basic cause and effect relationship between things, or even how to look for what's true and what's false and all that. So we've completely failed in terms of our education, and the education system, at least in the U.S., is very uneven. You have, even with public schools, you have some public schools that are fantastic and some public schools are absolutely terrible. We've got to fix this problem, because otherwise people cannot tell the difference between what's true and what's fake, and they don't know how to think scientifically.
Yes, Pilar.
So I had a thought that is not specifically about social media, but that goes back to Michael's point about, we've created this third group of people who are, not just refusing on their own behalf, but very resistant to the whole concept of vaccines. And although I think there's enormous amount of social complexity here, I also think that there are things that as scientific communities we can do that either at least move people on the margins one way or the other, right? And so there is some self-examination that needs to happen about like all of these studies that were thrown up on preprint servers that got a huge amount of publicity. And I think there became a kind of incentive for scientists to put up their papers really, really early, right? Because you could get attention in the media doing that, and your institutions always favor that, your work is garnering public, sort of attention and impact. So, and I think in at least some cases that was clearly the wrong thing to do. In some cases, it turns out there was fraud in some of those papers that was later discovered, but not so widely reported in the media. And so I think we need to be a bit self-examining here because, we kind of jumped into, and I mean, you're in a pandemic, some things are going to change and that's appropriate and should change, right? But some things that changed in the scientific community, maybe for the worse.
Well, as somebody who trains public health professionals, I don't want to walk out of here staring at the floor being depressed. This all sounds very bleak, ladies and gentlemen. How is there a role for big data in this, that we can use big data to try and counter the momentum of misinformation or disinformation? Is there a way to, as you say, to move people off the margins? Cynthia.
I think we have to be very careful about making that assumption. And the reason I say that is because I gave you the examples, for example, with clinical trials on the vaccine and ivermectin. Here you have two juxtaposition issues where one has an abundance of really well done clinical trial data, the gold standard of scientific research. The other is based on fraudulent information or where studies were done showing no benefit whatsoever. And it doesn't matter how big these studies are. It doesn't matter how much data is there. The challenge is much deeper than the data. So data are critical. I'm in this business. I'm an epidemiologist. Everything counts. But at the same time, I think this is an awakening for us. And I think academic institutions, I think societal institutions, our churches, many of the areas are going to have to re-examine themselves. Who are they? What are they? What is this all about? And I don't think people really fully understand that yet. I'm part of a group that basically worked to ensure safe and fair elections in the last election. And I was brought in as the novice, you might say, pandemic preparedness person, so I could comment on if things were actually happening that were not really based on the pandemic, but were, for a reason or another, an advantage to one group or another in the election. But I'm around a lot of really, really brilliant public scientists, public policy experts, legal minds. And I have to tell you, I walk out of some of these meetings and I'm so damn depressed because they're all sitting here saying, you know what? Our very nation right now probably has not experienced this kind of potential fracture since the Civil War. And I don't think people understand that. And, going into the next election, already there's a huge challenge. What will it be like? Will it be a fair election? And so I think we as scientists are part of that, but we're also at the same time doing the business of what we do. And so we have to understand we can't divorce ourselves from the reality of what's out there, and that's not easy. It's not easy. But if you were in World War II and you were in the darkest days of the war, you couldn't give up. It was important to feel, oh my God, can this get worse? And it got worse. And yet they won. And I think that's what we're all about right now. How do we get through this? And how does our respective disciplines, our careers, the very things we stand for? Because I believe that this group on this panel today stand for some of the ideals of what information, data, and improving the human lot is all about. But how do we do that in a world right now that is so challenged? And I think that's the heart of where we're at.
Dr. Rudin.
Okay.
Michael,
Thanks.
can I just
So
follow up
like-
with that just really quickly, though? I feel like
Okay, I give up.
Poor Cynthia.
you were talking about data about COVID and infections and so forth, but maybe there are social data that could help to answer the question. And I'm sorry. Yeah.
No worries. I'll say it really quick so I can get it in there before I get interrupted again. So I was going to say that one thing we really need is regulation. I mean, there's so much harmful rhetoric out there that it's very clear that we need some regulation. It's harming huge groups of people and causing deaths and so on. The other thing that I think we need, there is a group of people whose sole job, the whole livelihood is based on convincing people to do things. And those are people who study marketing. And if you've ever heard any of them speak about what they've been doing about the pandemic and the way to talk to people to convince them to do things, we need those people to come and help us out and do more of what they do.
Thank you. Francesca.
I just want to very briefly try to be a little bit optimistic and so I like also to always to describe myself as an infectious optimist. So let's see if it's going to work here and I can spread some optimism. So I mean, I think that, so I completely agree about the moment of crisis. I also do believe that the crisis is always an opportunity. And so I do think that for as terrible the COVID-19 crisis has been, I do think that it's going to lead, and I think it's leading right now, to really start to do some self-reflection and thinking about what do we need to do. And I think Cynthia pointed out something extremely important that many people are already working on, which is regulation in terms of how the spread of information and how the information and the fake information spread. I also think that there is going to be a push, and there is a push about access to high quality data in the context of the COVID-19 pandemic. And that has been actually a real challenge, I think, except for the fantastic, fabulous work of the Johns Hopkins dashboard, which I think they were really, basically was the only place where we can get access to data, but still the data was very aggregated. And I think there is an increased appreciation for timely and accurate access to data. And I do think that in terms of the profession, I think that the COVID-19 has really, put into question, I feel, a little bit the credibility of the public health professional. And I do think that this is also another crisis that will lead an opportunity to really think it through in terms of how we, and what are the policy procedures under which we, share our fundings and our results. I really appreciate Rhema point, as in New Zealand, you had a little bit more, I would say, you've been a little bit more restrained in terms of expressing opinion, which I think something didn't happen in the United States. So I think we have a lot to learn, and I think a lot of mistakes hopefully will provide the opportunity to learn and do better.
Thank you. Dr. Williams.
To get at your question about how big data can influence COVID-19, and if it can, people are data scientists, and often big data doesn't include them. It doesn't include their lived experience. Wendy made this point earlier, about global warming, but it's snowing right here, so it must not be warming where I am, and so. I think about it from a perspective of what data does it take to change a person's mind? And often big data doesn't do that. It's the personable data. It's knowing someone who has been infected, who is on a respirator, who's in, intensive care. And all of a sudden, oh, like this is real. This is something that I now need to, respond to. And I'm not saying that's ideal. I don't think that's a good thing. But when I think about the public and what changes the mind of the public, it's a personal connection. It's a personal relationship, because people are doing personal data mining all the time, right? They're collecting all this data about themselves. They think, I'm healthy. If I get sick, it'll be fine. But as soon as your neighbor does, and they're not doing okay, now all of a sudden it's like, oh, well, maybe I should get vaccinated. Maybe I should do this thing. And so I think we have to think about creative ways to maybe showcase stories, sharing stories of here's this family that was in ICU, mom and dad passed away, left these kids. Like that causes people to sort of say, whoa, I don't want to leave my kids behind. What do I need to do to get this vaccine? So those have been situations where I've seen data literally change people's mind by presenting them with stories, not hitting them over the head with facts, hitting them with, right. I don't want you to leave your kids behind. And if this means that you get to make it another 50 years, take the vaccine for your kids. Take it, for this reason.
Okay. Dr. Osterholm, you had a point.
Well, let me again just come back here. And I realize I'm the odd man out here. Okay. And so I accept that role. But, we've got 70 million Americans right now who are eligible to get vaccinated who have not. We have hired some of the finest public relations firms in the world to promote vaccination and understand this. We're at the lowest level of new vaccinees per day that we've been since the beginning of the pandemic vaccine availability. We're making no inroads at all. Even in settings where we have seen people die, rarely do we see people actually have a major conversion at that point. And I can give you rhyme and verse, many examples of that very situation. Again, it's calling into question, what is it that we really have to do? How could we still have 70 million Americans that won't get vaccinated, just as you said? And we have many thousands of children today who are orphaned because they've lost both or the only parent they had to COVID. You can't get a more compelling, story. So I think that even there, again, conventional wisdom, and I'm a student of that too. I mean, I've spent my whole career promoting vaccines. I've worked up many outbreaks, measles vaccines issue. Nothing's like this. This is a very different world, and I think that's what someone like me is trying to share with you, is having been on the front line, having been out there. This ain't our grandmother's pandemic. This is a different world order that's happening. And it's so divided that all the traditional public relations, outreach, etc., just isn't working. And my colleagues will tell you that. My colleagues are on the front lines. I've had over 50 of my colleagues from public health resign over the last 2 years over threats and inability to do their jobs. That's never happened before in my 46 years in public health. So I don't want to not say we shouldn't do all these things. We shouldn't try these things. I'll try anything right now, because as I said this about my kids.